let's be clear, black people. White people will cut off their nose to spite their face. As much as they need health care, as much as this is bankrupting America, the healthcare system, as exorbitant as the prices are gaining, Europeans fight universal health care. One, because they fear that blacks will benefit from it. Two, the current Medicare system, because it was presented by a black president, because it was passed and pushed by a black president. White people will cut off their nose in order to spite their face. This is why I believe in complete and total separation from Europeans, because the only time I believe the blacks has really done well and excelled in America is during the Reconstruction period, because immediately after slavery, we understood the significance in separating from these Europeans as much as possible.
This is the impoverished Southeast, coal country, hit hard by the downturn in that industry. It's one of the poorest regions in America and one of its least healthy. It's where last November, people voted overwhelmingly for Donald Trump.
This is Whitley County. Like many counties in this region, voters here overwhelmingly supported Donald Trump in November's election. The county has a median per capita income of around $16,000. It's 97% white, and 88% of the residents over 25 don't have a college degree. It also happens to be the birthplace of Kentucky Fried Chicken. And these are some of the Americans who have benefited most from Barack Obama's signature health policy, the Affordable Care Act, or Obamacare.
Since Obamacare kicked in, some 440,000 Kentuckians suddenly found themselves able to be insured. Most of that because Obamacare broadened coverage for America's poor. And in that group, just for example, breast cancer screenings went up 64%. Hepatitis C screenings more than tripled. Diabetes screenings rose more than 700%.
Since Obamacare launched in 2013, the number of lower-income, less educated white Americans with insurance increased dramatically, not just in Kentucky, but nationwide. This group benefited disproportionately from the law. Yet the same demographic showed up in huge numbers for Donald Trump in November. That's Kathy. She works as an enrollment counselor for Obamacare, helping people sign up for the program. Since the law was implemented in 2013, the percentage of people in this county with health insurance went from 75% up to 90%. And Kathy has signed up a lot of those people.
I couldn't even count them. I'd have to sit and figure them out. Over 1,000 something.
But here's the curveball. Who did you end up voting for?
Trump.
Perfect example of what I'm speaking of. This woman voted against the party that provided her with her job, allowed her to sign countless members of her community up for health care that they did not previously have, but yet she support the opposition, who ran on a campaign to repeal the healthcare system and provided you with no real alternative. White people will cut off their nose to spite their face. Understand this, black people. This is why I am 100% about complete separation from them.
Real change begins with immediately repealing and replacing Obamacare.
That is the apple. That's for his breathing.
Their message to Donald Trump, do the math. The Taylors are now on $6,000 a month worth of medications, nearly triple their monthly income, but paid for by the healthcare system Trump labels a catastrophe. Did you vote for Obama?
Nope.
A vast paradox in Donald Trump's America. They support him as president still. But last week, when Republicans failed to cancel Obamacare, it was like a death row reprieve. For countless voters, the healthcare debate has gone beyond partisan squabbling. Plain and simple, it's a matter of life and death.
I went to Kentucky to talk to Kathy. I wanted to understand why so many people would vote for a candidate who promised to repeal a program they depended on so much. We landed on a couple explanations for this Trump-Obamacare paradox. The first is that people in Kentucky believe that Trump and the GOP would never actually repeal a program that has benefited over 20 million people. So you don't think that they would actually do that?
No, they couldn't. That would be like, he's got children, he's smarter than that.
We headed over to an antique shop where the owner, Bobby, was another Obamacare enrollee.
I had breast cancer last year. So I was very happy to have my insurance. I didn't realize that the government was subsidizing my health insurance. And I do think everybody...
This is how hateful this woman is. This is how hateful she is. Medicare, created by Obama and the Democrats, saved her life while she had breast cancer, but she wants to complain that it was government subsidized. Who else thought was paying for it? You wasn't paying for it. What difference does it matter who paid for it? You should feel that your government is obligated to help save your life. You pay them taxes, don't you? But they're so hateful, they fear that Blacks would benefit from this.
Deserves quality health care. I just think the American form of health care is just totally out of hand price-wise.
One of Bobby's complaints about the program is that it has been linked to a president she strongly dislikes.
I absolutely detest hearing the words Obamacare.
Yeah.
Detest it.
Why? Why do you detest hearing Obamacare and it saved your life? The Republicans were not pushing for this. Why would you detest what saved your life? White people will cut off their nose in order to spite their face. Real talk. Pay attention. This is why I am a separatist.
To be clear, 2 months and a bit into the presidency of Donald Trump, here in Kentucky, he is as popular as they come. Outside the Freedom Hall Arena, the lineup, 20,000 people on a weeknight, is as long as it is loud.
Build that wall! Build that wall! Build that wall!
It is supersized everything. Red caps all over. T-shirts that mean it.
Where's your camera there?
Yes, we're over here.
Beloved for Donald Trump, with all of them here to simply say, keep at her. And on the wall behind the stage, his message to them couldn't be more clear. Promises made, promises kept. So, about those promises.
Donald Trump didn't campaign on a plan to replace Obamacare. Instead, he focused on the promise to repeal it.
It will be repealed and replaced, and we'll know. And it'll be great health care for much less money.
An analysis by the Nonpartisan Commonwealth Fund found Trump's proposals would leave up to 25 million people uninsured.
But the people we talked to didn't seem to need a plan. They felt frustrated with the current version of the law and seemed to be okay to take a gamble on Trump's promise to
Repeal and replace with something terrific.
Mr. Ryan has said a top priority for the new Congress is going to be the repeal of Obamacare.
In the mountain town of Whitesburg, consider the local healthcare clinic, Mountain Comprehensive, which itself has expanded greatly under Obamacare. It's seeing far more patients than before and can now offer more and better services than ever. They too have a message for Republicans considering next steps on a healthcare redo. Keep Obamacare. Into all that on this day, as it turns out, the Taylors themselves coming to the clinic for Robin, courtesy Obamacare, to have a checkup on her diabetes.
Are you coughing right now?
Yeah, it's smothered, son.
But when the doctor happens to ask Mike, how's he doing?
Take a deep breath.
needs IV fast. Robin is shaken.
We did not know he was even sick.
It reminds her of the stakes if and when Donald Trump and the Republicans try once again to reinvent American healthcare. Like so many Americans, the Taylors now like it just the way it is.
Thank you. I'll be here. Thank you.
If you lose your insurance coverage, what is your fear?
He's gonna die. I will have to sit and watch him smother to death because we ain't gonna be able to afford him to come to the doctor when he needs to come, him to go to the hospital when he needs to go.
We traveled to a mall right on the border with Tennessee, where Kathy sets up a booth to help sign people up.
Do she want him dead? Why would you empower someone who ran on a campaign to take a service away from you that you need for your very life, you and your husband? Do you want your husband to die? Why would you empower the very people that's going to put you in the predicament that causes his death? They're in office because people like you in Kentucky ran to the polls and empowered these people to put them in a position to threaten your health care. This is why I say white people will cut off their nose to spite their face. Now you're on TV crying tears and wondering if a person that you voted to put in power is going to take a service that you need for your very survival.
For Obamacare. We talked to the mall manager about his perspective as he sees many of his employees and coworkers signing up for Obamacare.
Initially, it seemed that everyone was excited that they were going to have an opportunity to have health insurance they could afford. It was some of the first time in their whole life that they'd ever had coverage.
We met up with Perry, a security guard recently signed up for Obamacare. This is the first time he's ever had health insurance in his life.
I've not been to a doctor. You probably wouldn't have been in this world last time I went to a doctor.
Really?
Yeah.
Thanks to Kathy, Perry was able to sign up at healthcare.gov just a few months ago. But his deductible ended up being $2,000.
Unless something drastic was to happen. How many times will I have to go to the doctor or something before I would use up over $2,000? I just wish that if they're going to shove it down your throat, have something other that you can afford.
While Obamacare led to 20 million Americans getting health insurance, half of the enrollees who get their insurance on the Obamacare marketplace say that the deductibles are still too high.
Go ahead, Kathy.
Hello, President Obama. I'm so excited to meet you.
It's good to see you.
Thanks. Many Kentuckians now are looking at the Affordable Care as unaffordable and unusable. How do you think this happened? How can we fix it? Do we start all over again? What do you think we should do?
This is my main criticism of Obamacare, of the Affordable Care Act, is that the subsidies aren't as high as they probably should be for a lot of working people. So the two things that we could do that would really make it work even better for people in Kentucky would be, number one, provide more subsidies to folks who are working hard every day, but still find the premiums, even with the subsidies, hard to meet. The problem is that that's not what's being proposed by Mitch McConnell, the senator from Kentucky.
Forming a caravan and heading for the border. This chartered bus will travel from Minneapolis, Minnesota, across the border to Canada for a shopping excursion meant to draw attention to a crisis in the United States. The aim of the passengers to buy stocks of the life-saving drug insulin. Insulin prices can be 10 times more expensive in the US than Canada.
$1,200 a year per person on prescription drugs. That's more than anywhere else in the world. 1 in 4 say it is difficult to afford those costs. Both political parties are now looking to tackle that problem, but with some different approaches. As William Brangham reports, the Democrats in the House went first today by passing their own bill. The bill is passed.
It's an ambitious plan to change the government's role in the cost of prescription drugs, costs that are becoming prohibitively expensive for many Americans. The bill aims to lower the price tag for prescription drugs, partly by overturning a 2003 rule that blocked the federal government from negotiating most Medicare drug prices.
Imagine for a moment popping a pill before bed that costs about $13.50. Now imagine waking up the next morning, find that the price of the exact same pill jumped to $750 overnight. That is just what happened to one drug.
Thank you, Brian. And Martin Sperley joins us now from the NASDAQ. He's the CEO of Turing Pharmaceuticals. Martin, thank you for joining us.
Thanks for having me.
Now, you guys have said that the reason you increased this price so much after acquiring the drug was in order to do the research and development to develop a better version of Daraprim. I just got off the phone with an HIV doctor who told me they don't need a better version of this drug. What are you doing here?
Minnesota state lawmaker Lori Halverson, who herself has type 1 diabetes, says the legislation is critical.
We need this to live on a day-to-day basis. I don't get through a day without my insulin. I don't get through an hour without my insulin. We're a captive audience. We have to buy this drug. We don't have a choice. And so to gouge people who don't have a choice is unfair. It's unethical, and we need to make
2003, who was the president? Bush. 2003. Bush Medicare law prevented the government from negotiating Medicare prices, from preventing them from putting the cap on these pharmaceutical companies, raising the prices exorbitantly without no real explanation. That was the Republican Party then push. And as you see, medication has done nothing but skyrocketed in the U.S. The U.S. pay more for medication than any other industrial nation, but has the most pharmaceutical companies because they can scam the American people because the Republican Party is participating in that. The Republican Party is in on it with them, and poor whites will vote against their own self-interest. Let's be clear, poor whites are voting against Medicare for all, and they are uninsured. If the government provides it, then blacks can receive it too. If we receive it through our job, we can discriminate against blacks and not allow them to get it. This is the format and the process and the thinking of white people. Why do you think they want their health insurance tied to a job that they fear is going overseas? Jobs that they are scared are leaving, they want their health care tied to, rather than have their health care tied to their government.
So what a lot of companies do is raise venture capital funding when they see an important market for a drug, rather than raising the price on the current patients who need it to survive and who have no other choice but to take it and pay the higher price. Why wouldn't you go that route?
Well, we did raise one of the largest Series A financings in history for a biotech company. We raised over $90 million. And we also feel that this is a more appropriate price for Daraprim. At this price, Daraprim is still actually on the low end of what orphan drugs cost. And we're certainly not the first company to raise drug prices.
There is a reason that we pay nearly 4 times more for prescription drugs than other industrialized nations. They use negotiation to lower drug prices. We don't.
Republicans say it will hurt competition and shrink the number of new drugs entering the market. Congressman Kevin Brady of Texas.
People want more cures and lower drug costs. They don't want more cheap political shots. We do, as Republicans, oppose H.R. 3's government price-setting regime because it will kill life-saving cures for Americans.
The House bill is not expected to pass the Senate, but the 50-page bill proposes 3 major changes. It lets the government negotiate Medicare prices for dozens of drugs each year, including insulin.
It caps out-of-pocket costs for Medicare patients at $2,000 per year, and it forces drug makers to give rebates to the government if their Medicare drug prices rise faster than inflation.
What Medicare for All will do is save the average American substantial sums of money.
The U.S. already spends more money on healthcare than any other developed country compared to the U.S. And what reforms may be coming? In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die than Germany. Here's how they did it. In 2017, U.S. healthcare spending came to around $10,200 US per capita. In Germany, it was a little under $6,000. Overall, Germany spent about 11.2% of its GDP on healthcare, while the U.S. spent 17.1%. Germany manages to cover 100% of its population. In the United States, about 8.8% of the population remains uninsured. That comes to about 28 million people, with even more people underinsured. Despite spending less, Germany has better or comparable health outcomes to the United States. In 2017, it's estimated that Canada spent around 10.4% of its GDP on healthcare. By comparison, the United States is estimated to have spent about 17.2% of its GDP that year. The OECD estimates that Canada spent around $4,500 USD per person in 2017. In the United States, though, the figure is expected to be at least double that, at $10,000 per person. Out-of-pocket spending is also lower in Canada. On average, Canadians spent around $650 USD per person in 2016. The average for Americans was around $1,100 that year. In childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher. Studies show that in Germany, there were fewer deaths that could have been prevented with proper access to care. In 2013, there were 83 avoidable deaths out of every 100,000 people in Germany, while the United States had 112. Life expectancy in Germany is 2.5 years higher than the United States, and the infant mortality rate is lower in Germany, with 3.3 deaths per 1,000 live births, as opposed to 5.8 deaths in the United States. Additionally, the maternal mortality rate in the United States is more than 2 times higher than in Germany. Researchers looked at the rate of deaths that could have been prevented with proper access to care across 11 countries. Canada ranked 7th on the list, while America was last. We can see the same trends in infant mortality rates. Canada outperforms the US, but other countries like Sweden and Australia have much lower infant mortality rates than Canada. Canadians also live longer than Americans. Canada's average life expectancy is among the highest of all the countries and is nearly 4 years higher than the US. Additionally, Canada's maternal mortality rate is almost 4 times lower than that of the United States, and more Americans die of heart disease and stroke than Canadians. So how does Canada manage to spend less money than the United States while having a more effective healthcare system?
In Canada, everybody has the same treatment. It would drive them nuts if George got better health care than Sam did. That's not acceptable in Canada.